One of the biggest group of people who have benefited from our practice in Oklahoma City are women between the ages of 30 and 60 who have been struggling with perimenopausal and menopausal symptoms. And you know what? A lot of them didn't think that there were other options by the time we got to them. My name is Jay Vintage. I'm a board certified family medicine physician in Oklahoma City. I own the Little DPC. And you know what? There's so many people that come in here talking about how they think that perimenopause or menopause is probably just this part of life, and they feel like that there are no options, and they feel like if they do options then they're going to have a stroke or something along those lines. And I feel like that the true risk benefit discussion hasn't been adequately had with these women, and by the time we actually end up having that discussion, oftentimes they choose, if they're able to do this, on hormone replacement therapy. Hormone replacement therapy can take on many forms. For example, like there's many ways you can take estrogen. You know, you could use topical creams, you could do something like topical gels. Most of my patients end up with a twice weekly patch, which is just a huge fan favorite because there's a decreased risk of a lot of the things that might be associated with estrogen, et cetera. And then progesterone, you know, which that can be offered in a pill. A couple things that people don't know is that the estrogen levels that are in these sorts of preparations are a lot lower than in birth control, and certainly a lot lower than what you would even experience in pregnancy. So the risks and the benefits need to be a discussion between you and your doctor, but this is something that we do all of the time at the Little DPC. And that is why after a couple months of getting on some of these therapies, we know very quickly whether or not people's lives are much better. And honestly, this is like one of the biggest groups of people that I would say are very satisfied with our practice of medicine. Hormone replacement therapy is not for everybody, but there are many people that think it's not for them when in fact it might be the difference between them having a full, amazing life or actually just feeling like that they're having to just hold on for dear life until death, and we don't want to do that. Keep in mind also that when applicable, when we use hormones, this can prevent you from having osteoporotic fractures in the future. This can decrease risks of some heart diseases, which is a longer conversation for later. But the by and large point is that we take care of many women. We take care of many women that are going through perimenopause and menopause. We help them be able to identify whether or not that is something that they are going through, and we help them through it.